Thank you, Madam Chairwoman, and thank you, Secretary Kennedy, for appearing before us today. I am going to try very hard to resist responding to what I just heard, but I do want to just say thank you for actually trusting moms to make the best decisions for themselves and their families, rather than continuing to perpetuate the narrative that only bureaucrats in Washington can make recommendations and force people into doing things that they know is not best for them and their children. As we review the fiscal year 27 budget, Secretary Kennedy, I think it's important that we focus not just on how much we are spending, but whether or not we're actually improving health outcomes for the American people. Now, too often we say that we have a healthcare system, but I personally believe that we have a sick care system. And we have a culture that perpetuates a system of maintenance rather than prevention. And I think much of what your initiatives do is trying to address the cultural issue as well as the structural issues within HHS. So I appreciate the administration's focus on prevention, nutrition, innovation, and I look forward to continuing the discussion on how this budget can move us in that direction while improving access and lowering costs. So recently we hosted Dr. Bhattacharya in the Gator Nation, North Florida, and I would like to extend a similar invitation to you to learn more about what we are doing at the University of Florida, the #1 public university in the country. I would be remiss if I didn't mention that. But what we are doing, particularly in the healthcare space and within R&D, to advance better outcomes and healthcare discoveries. So we would welcome the opportunity to host you. If you
I would love to come. My sister-in-law teaches at the University of Florida. And my wife's family lives there, and my wife is a alumni, so I'd be delighted to come.
Can I get a Go Gators from you then?
Yeah,
Okay.
go Gator.
All right, that's what I'm talking about. So let's talk about the spending and whether our federal health spending through HHS is actually changing outcomes and not just maintaining the status quo. Walk us through some of the challenges that you're facing and how we can be helpful in advancing those changes that really disrupt the status quo and drive us towards better health outcomes.
I mean, I would say there's the whole waste, fraud, and abuse issue that you're familiar with, so I won't dwell on that, but I would say the overarching issue that we're trying to create is the perverse incentives. We have a sick care system where people get compensated more for keeping patients sick.
Correct.
And Medicare Advantage was supposed to be the template for outcome-based care. We have other templates for outcome-based care. The whole system ultimately has to be moved to that. Fee-for-services is not a way that we're going to get Americans healthy. Mm-hmm. We need to align the economic incentives with the outcome of good health for all Americans.
Absolutely, I agree. And to that point, we've seen the use of QALYs, right, that has been prohibited when we talk about Medicare because they undervalue the lives of our seniors and people with disabilities and chronic conditions. That's just fundamentally wrong, in my opinion, to have an algorithm, a formula, determine whether or not you are of value enough to receive certain treatments. So as we're going through this, can you confirm that HHS will continue to uphold this safeguard and ensure that coverage and payment decisions are not based on discriminatory measures like QALYs, and would you be willing to work with us to extend and clarify this protection across all of the federal health programs?
I would be delighted to work with you on that.
Excellent. I know people around the country are celebrating that answer for sure. And shifting a little bit to the FDA while I've got some remaining time here, I would like to hear about how you guys are improving the clarity and predictability in FDA as you review different applications. That's something that I hear often, particularly from startups, of the process, it's still bogged down, we need to move faster. Can you just talk a little bit about that?
The process at FDA for approving
Correct.
new drugs, well, we're now using AI. 90% of FDA is on it. Using it, we've been able to to condense the time for reviewing final applications from typically 60 to 90 days to 2 hours.
Member's time is up, and you can answer her question via written circumstances. And I now recognize